All right. Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. I'm your host, Ashaye. I'm a family physician and owner of In Touch Primary Care in Sugar Land, Texas, and I am so excited you're here. This is the place to be if you desire to take charge of your health and you want to make sure you're doing all you can to live a healthy lifestyle. Remember, you can always listen to this episode and all our episodes on In Touch Primary Care YouTube channel. Leave comments, subscribe, and share. So today is a great day. We're going to be discussing proven methods to help people quit smoking. And this is so important because smoking is the number one cause of preventable death in the US and worldwide. And anything that can be prevented, we want to absolutely prevent, right? Smoking harms almost every single organ in the body, and it weakens the immune system. It significantly increases the risk of pretty much every type of cancer, and almost 1 in 3 cancer deaths are from smoking. It also increases the risk of heart disease, lung disease, rheumatoid arthritis, and so much more. So smokers today actually smoke fewer cigarettes than 50 years ago, but they're actually at a higher risk of developing lung cancer because of how they make cigarettes now, the composition of the tobacco and the cigarette design. For example, with the ventilated filters in cigarettes, people actually inhale more strongly. And some people have the wrong impression that those are less harmful, but those are actually more harmful because the carcinogens, the cancer-causing chemicals gets deep into your lungs. So there are up to 70 different chemicals in cigarettes that can cause cancer. So there are many different chemicals that are harmful to the body in cigarettes. 1 in 5 deaths every year in the US is caused by smoking. So that's over 1,300 deaths every day from smoking. And these deaths include 41,000 deaths from secondhand exposure. So smoking actually does not only affect the person smoking, but those around them. And this is another reason why it's so important. And on average, smokers die 10 years earlier than non-smokers. So there's so many disadvantages of smoking. And there is a need to help people quit smoking. So most of us know smoking is not good for our health. And 70%, studies show that up to 70% want to actually quit smoking, but only 5% will be successful without help. So smoking actually should be treated as a chronic disease because many people that smoke and quit may relapse. So it's so important that if somebody is a smoker and or was a smoker, and even though they've quit, that's something that should still be addressed over time because that person is at a risk of relapsing and still causing problems over time. But quitting is not so straightforward, right? Otherwise, many people would have quit by now. Up to 70% of them would have quit, right, if they wanted to quit. But studies show that nicotine, which is the substance in cigarette smoke, is actually as addictive as heroin and cocaine. So nicotine can be as addictive as heroin and cocaine. And that is why it is so difficult for a lot of people to quit. So some people may be motivated to quit. I know some of my patients are motivated to quit, and some of them have even quit in the past, but sometimes there is relapse. So physicians, though, that use evidence-based programs can more than double successful quit attempts. So it is important that when you do want to quit, that you follow up with a doctor who is using evidence-based programs to help you quit. So today I'll be sharing 3 of those evidence-based strategies that can help you quit successfully. So some of you may have tried some of these things already, but I'm going to discuss some of the things that may have made your efforts not successful or that will make your efforts successful, okay? So the first one is having a quit plan and sharing it. So the quit plan needs to be a written plan that has a specific quit date. So ideally, you want to have a plan within 2 weeks of your decision. And then you want to share the plan with someone you trust. So picking the person you trust is actually quite important too, because as I said, a lot of people have tried to quit smoking in the past, and some of them were successful for a few months or even years and then restarted. And so people closest to them may not have the same trust in them or faith in them that they can actually quit again. And so they may not be the best support. So your support person needs to be someone that actually believes that you can quit and that will encourage you to quit, and not someone that will judge you. Okay, so that's really important. And then in that 2-week period, when you are making that decision to quit and setting the date, you want to remove all tobacco products from around you. So some people are under the impression that tobacco products other smokeless tobacco products can help them quit, and that is not the way to go. You don't want to replace one tobacco product with another tobacco product to help you quit. So you want to remove all tobacco products from your surroundings to give yourself the highest chance of quitting. And also the other thing that comes up is people try to cut down, but the truth is studies have shown that even smoking one single puff can increase your risk of relapse. So the cold turkey way is the way to go. As much as you can, prepare ahead of time and have a written plan with a specific date. So you can have a plan that says, for example, I will quit smoking entirely on August 31st, 2022. And that would be great. That would be a great plan, right? If you made such a plan, let me know. That would be so awesome. I'm always so excited when people quit smoking because I truly believe it's one of the very best things you can do for your health. Anyway, so that's the first one. Have a plan, written plan, and share it with someone you trust. Okay. And then when you've made that decision, make sure that closer to the time, you're removing all tobacco products from your environment, and that will make you more successful. The second thing that is evidence-based that you can do to quit smoking is anticipate and prepare ahead for challenges. So relapse is highest in the first 3 months. So it's important that you have support in that time to prevent relapse. And the challenges around relapse, there are 2 main ones. One of them is triggers. And most smokers know, or most people that smoke know what their triggers are, right? So they know that, if they're stressed out, or if they're drinking alcohol, or if they're drinking coffee, they're more likely to smoke, or when they're around friends. So a lot of people kind of know it. Some may have not really sat down to identify it, but many people can tell what their triggers are. It's important to really identify those triggers, make sure you're clear about what they are, and then prepare for them. So for example, if you know that you're triggered by stress, you want to think about, what am I going to do to distract myself when I'm stressed out? Is there something else, another behavior I can adopt that would decrease my stress? So for some people, it's going for a walk or exercising. For other people, maybe listen to music. You have to kind of decide, but you have to do it ahead of time, because when you try to do it in the moment, it's actually much more difficult. So ahead of time, you want to prepare for what you're going to do when that situation occurs, because it is going to occur. So you want to be prepared ahead. And then the other thing you want to do is also if you are triggered by things like alcohol or caffeine, you may want to change your habits. So for example, if you drink coffee every morning and then you have a cigarette, then you may want to change the time of day you drink coffee or the place you drink coffee. Just change up something so that you trick your brain into not making that association like, oh, now I have to smoke. So you may have to change your habits somewhat to be able to quit and to be able to avoid getting triggered. And drinking alcohol is very, very closely associated with smoking. So it is actually strongly recommended for those that smoke to try to limit or abstain from alcohol to make your quit attempts a lot more successful. So that is number 2. So number 1 was have a written plan and share it. Number 2 was anticipate and prepare ahead for challenges that will make you most successful. Now, the third one is making sure that you are not replacing one negative habit with another negative one. So there's a lot out there about, nicotine replacement option. Tobacco, other tobacco products that have that you can use to help you quit smoking. So, for example, vaping products. A lot of people will quit smoking and start vaping. And while vaping products have been shown to be less harmful than cigarettes, they have been associated with lung injury, especially when they are used long term. And in addition, there are very mixed and inconsistent findings as to whether it actually helps people quit tobacco. So there are also many ingredients in vaping products that are not known, so we don't really know yet what the true risks are. So it's not a good idea to replace, tobacco smoking with another, tobacco products or with vaping. It's better to do a nicotine replacement therapy like a patch, a gum, or combination therapy. Okay, so that is the first thing. That's the third thing. So very important, vaping products, try to avoid them. Other things like smokeless tobacco is another one, where people are chewing or using dissolvable tobacco, different things or snuffing. Those two have not been shown to help with smoking cessation. So that's also not a good way to quit smoking. E-cigarettes there's no evidence that e-cigarettes help with smoking cessation, and those should be avoided as well. And things like nicotine-containing lollipops or drinks or lip balms, there is no scientific evidence that those help either. What has been shown to help are nicotine replacement products. So, and that's another thing that I wanted to touch on actually in terms of when people smoke. Another big thing that happens with people when they're trying to quit smoking is they may have withdrawal symptoms. And withdrawal symptoms, sometimes things like irritability, anxiety, they feel foggy, they may have difficulty concentrating, and having that might make it difficult for them to want to continue to quit. Withdrawal symptoms can typically are worse in the first few weeks, and that's where medications might be helpful for those people who have withdrawal symptoms. So that will be part of anticipating and preparing challenges where if you've had withdrawal symptoms in the past and that has triggered you to smoke again, you want to have a plan with your doctor to make sure that, those could be treated, because medications significantly reduce the withdrawal symptoms. And so it makes it easier for you to quit. Okay, so I wanted to mention that weight gain is another possibility, and that's because nicotine is an appetite suppressant, which means you don't feel like eating as much when you smoke. So when you quit smoking, you're going to be more hungry, and so you're going to probably eat more and gain more weight. So it's important, again, to have a plan for that, so that you're prepared for how you're going to deal with the weight gain that may occur when you try to quit smoking. So again, 3 main things you can do. Number 1, have a plan, write it down, share it with someone you trust. Number 2, anticipate and prepare for challenges like the triggers and withdrawal symptoms. And then number 3, do not use tobacco products to try to help you quit, because they haven't been shown to help. Try to use nicotine replacement products or talk to a doctor about other medications that also have been shown to significantly to help people quit quite a bit. So those will be the 3 things that I want to share. But the good news is there's so many benefits of quitting. And those benefits actually start to happen almost immediately, within minutes of quitting. We know that people's heart rate and blood pressure are lower within 3 weeks of quitting, they've increased their lung function and their circulation. Within a month, they've decreased cough and wheezing. Within a year, they're already decreasing their risk of cancer, heart disease, lung disease, and overall decreased risk of health condition, decreased risk of dying early, and obviously decreased cost, because the cost of treating a smoking-related disease versus stopping smoking is, a much lower to try to quit smoking than to try to deal with the conditions that come with, smoking. So those are the main things I wanted to talk to you about today. So if you made a decision today, and if you are, it's important that you go ahead and stick to it the best you can. Use the strategies that we talked about. If you want to share them, please leave a comment, send a message, let us know how it went. We're really, really rooting for you. And there are people that make that decision and need no help at all. They're just able to quit, and 10 years later, they're successful. They've never relapsed. But then there are other people that have been saying they want to quit for years or months, and they haven't done it yet. So, or have said they think they can quit if they just make up their mind, but they haven't done it yet. Many of those people will need help and support to quit. So if you are in that category where you need help and support to quit, and you're looking for a doctor to support you on that journey, check us out at In Touch Primary Care. We do things very differently at In Touch. We can see you even if you don't have health insurance, and our practice is set up so that we can spend time with our patients so that they can reach us easily and so that you don't have to delay care. You can find out more about how it all works on our website, www.intouchprimarycare.com. And if you made a decision today, again, please share, put it in the comments, share what has helped you as well in the past if you've successfully quit smoking. Thank you for joining us today. Remember, write it down and share your quit plan with someone you trust. Anticipate and prepare ahead for challenges. Use evidence-based replacement products, and avoid using products that don't work or that may be harmful. And you can do this. I'm rooting for you. Please subscribe and share with someone that might need it. Thank you for joining us. Have a great day.